by doing percussion, but studies show us that direct pressure works better than percussion. It's just plain old direct pressure. I believe it's because we can be more accurate where we're providing the pressure when we're doing that, as opposed to when I'm doing this, I'm bouncing all over the place. And so you can do either in your test for this class, and I will give you credit if I ask you for Janelle's test. You can do percussion or just direct pressure. Either one's fine. But that's what happens here, is you push here and you feel it shooting into the hand on the palmar side of the hand. And the exact location of where this happens in the hand we'll talk about later, the distribution of the median nerve. But we also have the anterior osseous nerve. And when that anterior osseous nerve gets entrapped, there's a test that we do because of what it innervates. So the anterior osseous nerve, here we go. There's no cutaneous. So that means there's no innervation to the skin. I can't test skin sensation for the anterior osseous nerve. But what it does do, it innervates the pronator quadratus, but for us, we don't care about that part. The part that we care about for this test is that it innervates the flexor pollicis longus and the flexor digitorum profundus. And to be exact and specific with what I'm telling you right here, it's the flexor digitorum profundus for the radial side, not for the ulnar side. It's the ulnar nerve that innervates the flexor digitorum profundus. The ulnar side, which we don't care about, because all we're going to care about is this one and this one. And we do something called the pinch test. So basically, I'm testing strength of these two muscles. So what I'm going to do is I'm going to instruct the patient to pinch the index finger and thumb together like an OK sign. You're making an OK sign. And I want you to hold that sign. And what we're going to do is we're going to put a piece of paper in here. I'm going to tell you to hold that as I pull it away. Now, for motivation, are you ready for this? Yeah.
Whoa!
Oh,
mama! Whoa! Woo! That's chiropractic dollars.
If you can hold it, you can keep it. Okay, that's called motivation. I want you to do that. Go ahead. Make your pinch.
Come on, Joe.
Come on, Joe.
Lunch on Joe.
Go ahead. And I want you to hold it nice and tight. Now, while he's holding it nice and tight, and I'm pulling on
Come on,
him,
Joe.
he's starting to fatigue, which is good. I don't want him to fatigue. Hold on.
Joe, come on.
Come on.
There you go, you're pulling hard.
Now, slow down here. This is the test. The pulling is the test part. Okay? And so you need to make that okay sign and keep the okay sign. Come on. Okay. Hold on to it, okay?
I'm not ready.
I'm looking to see, do you keep the okay sign? And when he's not thinking, now let me show you one more thing, because I have done this before. You don't do this, just like when you adjust. You have to maintain tension, because you can't rip it, but you thrust when they're not thinking. You always get your money back. That's important. Okay? But it does give you motivation to hold properly. Now, given that, if he can maintain the okay sign,
I already knew that was impossible. It's okay. I was expecting to fail, so.
if he can maintain the okay sign, it looks like an O. That's a negative finding, because that shows he has strength in his flexor digitorum profundus, which is the interphalangeal joint, and the flexor, I did that wrong. Flexor digitorum profundus, which is the distal interphalangeal joint of the finger, and the flexor pollicis longus, which is the interphalangeal joint of the thumb. If those muscles are weak because he has entrapment of the anterior interosseous nerve, instead he'll do this. It looks like a teardrop instead of looking like an O. I've instructed him to keep the O, but it looks like a teardrop. So if it looks like this, let's see if I can do this. That's a positive finding. And it tells me there's weakness of those muscles, which tells me there's entrapment of the anterior interosseous nerve. You with me? We're good? That's called the pinch test. It's important to keep this right, because next week we're going to do something a little different, but it's a little different. So I want you to practice the pinch test. Describe to your partner what muscles you're testing and what nerve you're testing, because this is exactly what you'll have to do to me when you take that test. That's staying in my pocket. Okay, so practice this right now. Tell your partner about this, then we'll take a 10-minute break, a 5-minute break. We'll be back here at 8:30 to continue on.
Right, I want to test your anterior.